Hello, my name is Gabby, and I am going to be talking to you today about electronic health records, and how they relate to IT, information technology within healthcare. EHR, electronic health records, are incredibly important right now to our medical practices, our hospitals, all of that, because they are what keep patient documents and patient quality high. So basically, this is when you go to the doctor and they come in with a computer, not necessarily charts anymore, that's outdated. They come in with a computer which has a system already already a software system in the computer, where they have the patient's name, all their medical information, immunizations, previous histories, allergies, everything that you have told a doctor in the past, they will have already in one specific system. In this, I do go into detail about the ups and the downs regarding information technology and what parts of IT go into making this system, and how this system is going to benefit hospitals, healthcare in general, patients, making physicians' lives easier, nurses' lives easier, medical staff's lives easier, administration easier, HR easier, everything much, much easier, because this type of technology has been innovated and adopted by many practices and many people. Lately, it's becoming more and more. It's a very expensive software to have, but it's definitely worth it, and it's something that nowadays technology has advanced completely. It's quite great. Some of the ones that they have, depending on how much work goes into it, a lot of them could be web-based, which would be a lot easier to create, or I guess program, or just to make. They're a lot cheaper that way. The ones that are a lot more expensive, that are based for bigger hospitals, larger practices, locations where there's more physicians, more staff, that's going to be not so web-based, but more a system that connects to the web, rather than having this kind of like portal already within the internet. This will be a software within the computers, and they kind of like network together within the practices. The good thing about EHR is that you can have one doctor, let's say in California, and a doctor, let's say you have an emergency in Virginia. That Virginian doctor will be able to see exactly what you're allergic to, what your previous medical history is in California from that doctor, and be able to get it in real time and process that in real time. This does save a lot of lives. This also is really great because nowadays a lot of medications cannot be mixed with other medications, and doctors have no idea sometimes what medications are being given to the patients, and sometimes patients don't even have any idea what medicines they're taking, and that can be really bad, because then doctors are giving other medications that could counteract with medications that they are already taking and cause severe side effects, sometimes leading to seizures, death, a lot of harmful things to our health. So being able to do that has definitely increased patient quality care within healthcare, and definitely, information technology has played a ginormous role in creating this. So it's definitely great that this is something that we have come up with, that we are still expanding, that we are still improving, because there are a lot of things that still need to be improved security-wise, accessibility-wise, and in learning also, because there's training, it's very extensive if you're going to learn the ins and outs of this program. So, and a lot of it has to be done on computers. A lot of it is also understanding IT, how these things work, and so that is the video I'm going to do on my research paper. And if you read my research paper, you will a lot more information, a lot more detailed, a lot more organized in this video. Thank you.